Alright, let's finish up this chapter. So, the next system we're going to look at is the heart. Now, the heart is considered to be radio resistant. Um, However, for high doses, the heart can show signs of inflammation. So, pericarditis can occur, which is the inflammation of the pericardium. The pericardium is the membrane that covers the heart. At higher doses, um, pancarditis can occur, which is the inflammation of the entire heart. So you can also get myocardial fibrosis, which is essentially scar tissue forming in the heart, and things like that. But the high doses necessary to see these effects are really only seen with radiation therapy. So, for example, in the treatment of malignant lymphoma following mastectomy for breast cancer, whenever possible, the heart should be shielded as much during those treatments. Another system which is fairly radio resistant is bone and cartilage. Certainly the mature bone and cartilage is radio resistant. And the main concern might be osteonecrosis, which is damage to the vascular system and the disruption of blood flow to the bone. So it's not actually the bone itself, it's the vascular system. And we talked about that when we talked about blood flow there. By damaging the blood supply to other organs, the vascular system can play a role, not just in the vascular system, but in other systems. Here's an example of that. However, in children, the bone is still growing, the cartilage. So these consist of rapidly dividing and undifferentiated osteoblasts and chondroblasts. And so high doses to children can slow or even in an extreme case stop bone growth. So it's not without its concern, especially if we're doing bone-seeking radionuclides, which are sometimes used in the treatment of animals and adults, but if used in the treatment of children, could be sort of problematic. Wilms tumor is the most common type of kidney cancer in children, and most often affects children ages 3 to 4. And while neuroblastoma is a cancer often found in the small glands on top of the kidneys, the adrenal glands, this is also more commonly affects children 5 or younger. So these sort of abdominal childhood cancers are usually managed with a combination of surgery, chemotherapy, or radiotherapy, with radiotherapy being more common in sort of high-risk tumors, post-chemotherapy. And so bone abnormalities due to this irradiation can occur in the spine, and you get scoliosis, right? The sideways curvature of the spine sometimes occurring. The next tissue is liver. The liver is relatively radio resistant. However, the liver requires a large blood supply, and so again it's susceptible to the radiation damage of this vasculature. Radiation hepatitis is one of the late effects. This just basically means inflammation of the liver due to irradiation, and often sort of occurs as a consequence of the vascular sclerosis, and the vascular occlusion. So again, it's really the blood supply that is being damaged rather than the actual liver tissue itself. when treating the kidney, uh, for like lymphomas and ovarian cancers, uh, the liver may be totally or partially included in the treatment field, and doses can range from 35 to 45 grays with these treatments. And so the clinical significance of this really will depend on how much of the organ is in that is within the beam of radiation. Um, but some of the effects that can occur, you might get jaundice. Right, the jaundice is when the liver can't efficiently process the red blood cells as they break down. Let's look at the respiratory system then. So this consists of the nose, pharynx, trachea, and lungs. These constitute the respiratory system, which is mostly radio resistant. You can get radiation pneumonitis or inflammation of the lungs after a radiation. And this can occur at sort of low doses. Radiation pneumonitis can lead to chronic fibrosis at high doses, which basically renders the lung non-functional. Whether the lung is being irradiated directly or just happens to be in the treatment field as another organ is being treated, such as with breast cancer, doses of about 25 grays can cause progressive fibrosis in 8% of individuals. But this rises pretty quickly to 50% at doses of 30 grays. So how severe the consequences of this will depend on how much of the lung is irradiated, as only the areas irradiated will be damaged, and other areas of the lungs will remain functional. Let's look at the urinary system. So the urinary system is made up of kidneys, the ureters, which are through which the urine passes from the kidney to the bladder, the bladder, and the urethra, which is where the urine comes out of the body. Radiation nephritis is the term used for radiation damage to the kidney, and appears as a loss of tubules as the kidneys become atrophic. So basically the kidneys start to reduce in size. If the kidneys, if the kidney atrophy results in kidney function of less than 10 to 15%, then renal failure will occur. This usually happens around 6 months to a year after irradiation. In terms of the doses, certainly radiation therapy should limit the doses to less than 26 grays. As radiation nephritis generally occurs quite sharply as you transition past this to higher doses. And lastly, we'll consider the central nervous system. So the cells in the brain and spinal cord are non-dividing, differentiated cells, and so the nervous system is considered the most radio-resistant system in an adult. However, after high doses, inflammation can be observed in the spinal cord. This is termed myelitis. Large doses can also lead to necrosis and fibrosis of the brain or spinal cord, although these later effects are thought to be due to vascular damage. When treating brain tumors, it's difficult to distinguish the effects caused by the tumor and those caused by radiation damage. Now, in terms of the spinal cord, which is often included in the treatment field of lung cancers, cancer of the esophagus, Hodgkin's disease, and tumours of the head and neck. Doses greater than 45 to 50 grays, depending on the treatment area, may cause this myelitis. And that is the end.